Hey everyone, it's Dr. Ashley, pediatric emergency mom. I get a lot of questions about headache, and so I wanted to talk about specifically primary headache today. So headache is divided into two different categories, primary headache and secondary headache. So secondary headache we'll cover at another time, but those are the headaches that we really worry about that could be caused by something sinister, right? Like an intracranial mass or a head bleed or even an infection like meningitis. So we're gonna skip all of that for now and focus on primary headaches. So primary headaches for the most part in kids are either tension headaches, so just that band type headache that kids will get, and maybe because of an illness or allergies or weather changes. And then there's migraines. And this is where I get the most questions, is when it comes to migraines in kids. So migraines are the most common disabling primary headache disorder in kids. So this is the headache disorder in kids that's really going to stop them in their tracks and stop their usual activities. The prevalence of migraines in kids is actually pretty high, and literature, kind of depending on what source you look at, I mean, up to 20% of kids have migraines. And so some of those numbers have ranged from 11% and then all the way up to 20%. So it's not an insignificant number. It's a fairly large number of kids. They often go undiagnosed because they present differently than adults do, right? First of all, we're not really expecting it in kids, but then they just present differently. In migraines in kids, they'll have this throbbing headache, right? But they'll also some have light sensitivity, some have sound sensitivity, some have nausea and vomiting. Some even have movement sensitivity. So just, turning the head side to side really hurts. Things to look at, and when you're thinking about migraine, like, could this be a migraine in my kid? Think about family history. Is there a strong family history of migraines? If so, then your child very likely may have migraines as well. It's also important to look at what's led up to these headaches. How's their sleep? How's their sleep hygiene? How are their appetites? Have they been eating well? What about stress and anxiety? I will tell you, I'll ask parents to be very, very honest with themselves. A lot of parents say, oh, my child isn't stressed out, or it's just normal school stuff. And that may be what we're perceiving, but really that child is having quite a bit of anxiety. So really sitting down and talking to your kid and assessing their level of stress and anxiety. And then I have to say it, video games, and my kids would hate me saying this, right? Because they love their video games, even though we limit the time. But video games, how much time are they spending on a screen? And is that blue light affecting them? Is the flashing lights, the constant motion, is that affecting them and triggering these headaches? So with migraines and even tension type headaches, we want to treat the cause. So if it's lack of sleep, if it's dehydration, making sure they get enough rest, making sure they're hydrated. We can always treat with a dose of Tylenol or a dose of Motrin. And that certainly should help as well. The goal is to break the headache cycle. So if you have a child that you suspect, maybe they do have migraines, and they've had this headache that's lasting, you say it's their second episode of a headache like this, and they look kind of pale. Their last episode was last month. They played outside all day the day before. They weren't really drinking water. They got to bed late. They didn't sleep well. And now we have this headache episode again, where they're pale, they're nauseated, they're not wanting to eat or drink, the light hurts their eyes. Then you can be pretty confident that this is a migraine. And so we really want to treat everything that's led up to that. We can treat with Tylenol or Motrin, but we want to break the headache cycle. That's the most important thing, is to break the headache cycle. If you think your child fits the criteria for having childhood migraines, they definitely need to be evaluated by their primary care provider and may need to see a neurologist as well. Just like belly pain in kids, headache in kids, I tell parents, please, 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 please keep a headache diary. This is so helpful to ER physicians, to primary care providers, to neurologists, you name it, anyone. It's so helpful. So what you want to do is record the date and time that it happens. You want to record what they were doing leading up to the headache starting, what made the headache better, what did they do after the headache, anything you think could be helpful information with regards to that headache episode. So there are multiple apps out there for tracking headaches and even for tracking pain. But there are a couple that I thought were really user-friendly and pretty interesting. So tune into the next episode and I'll review some of those apps.